this is Marita from the Nurse Lounge, and I am working today. I'm doing my case management job, but while I'm driving between clients, I wanted to talk to you about the various areas in nursing, or not various areas, but the various degrees or fields, not really fields either. The various areas in nursing in which you could be a nurse, or at least where you can start. So however you are on this journey of nursing, whether you are deciding to go right into the 4-year program, or you want to take the scenic route and start as a CNA, no matter what you decide you want to do, I wanted to kind of talk to you about those different areas of nursing, or points, so to speak, so that you can kind of know what's good for you and kind of dispel any myths that's out there about how you get to the next level, basically. So we're going to start with the very basics in terms of being a CNA, a tech, or a MA, medical assistant. So a CNA is a certified nursing assistant, and their jobs are to basically do patient care. They are doing vital signs, doing ADLs, such as giving baths, transferring patients, getting them dressed, feeding them if they need help feeding, doing those tasks like that. Some CNAs are able to pull Foleys and some are not. I guess it's depending on where you were certified at and what the policies and the scope of practice within your state is. You'll see CNAs in hospitals, basically, in long-term care facilities such as nursing homes or rehab centers, and pretty much places like that is where I usually see most CNAs. You have patient care techs, which is basically the same thing in terms of what their role is. Now, whether they're certified to do anything, that I'm not sure, or they're just a tech and how they got to that role, I'm not sure about that either. But in terms of their job description, they basically do the same. Medical assistants are MAs, and they typically work in offices, but they can also do like a lot of your triage in terms of doing basic vital signs, and asking about, like, why are you here for this visit, like in a pediatric clinic or some other type of clinic like that. They can do those types of things. People tend to go into those areas of healthcare because for some people it is just an entry point into nursing to see if they want to kind of pursue nursing. For some people, they're already nursing students, so they want to have a job and be making money and learn as much as they can while they are studying to be a nurse. And some people, that's just what they want to do. They want to care for people, and that's just a job they want to have. So they don't really care to go beyond that. I've met people, believe it or not, who they just want to be a CNA, and there's absolutely nothing wrong with that if that's what they want to do. The next level would be a LPN or a LVN, and I believe those are interchangeable. LVN being a licensed vocational nurse, and the LPN being a licensed practical nurse. And they, I think, just based on location, they mean the exact same thing. But what their scope of practice is, or let's just say for school, let's go back to school. For schooling, they have a program, and I don't think they are a degree. I think they are either a certificate or diploma program in which they go to school for 12 to 15 to 18 months depending on the program, and when they graduate they have a certificate or a diploma, but they are considered to be nurses. LPNs and LVNs are nurses. So what is their scope of practice? It does vary by state, but for the most part, in general, they're able to do follow-up assessments. And basically what that means is if they get a new admission, LPNs cannot do the first admission on a patient. They do like the follow-up admissions, not admissions, they do the follow-up care. Or if an RN admits the patient, they can take over their care after the RN does the initial admission assessment. So they can't do those initial assessments. But they cannot hang blood. I think they can, once it's been initiated by the RN, I believe they can do like the continuing of maintaining it, but they can't hang like the bags and stuff like that. Again, this may vary based on state, so you may be able to do these things in your state. Most of them cannot push IV medications. However, I do know here where I work, we do have a nurse who does IV push because she's been certified to do so. So if you've been certified to do so, then you are able to push IV medications. But for the most part, RNs have to come push their patients, LPN's patients, IV meds, but they can give like oral meds and things like that, and give injections and those types of things. So where do they work? LPNs, LVNs can work in hospitals, but you will find those far and few as they're trying to get LPNs and LVNs out the hospitals, depending on where, again, what state you work in and city. At our hospital, we have, I think, 3 in the entire hospital because they are pushing to make everyone in the hospital RNs, and they're really wanting everyone to be a 4-year RN versus 2. But that's another story. So I feel that you will see them mostly in corrections, which is like your criminal justice, your prisons, your jails. They work there. They work in LTC, which is long-term care facilities. They work and they do, they're actually the ones who run the show in LTCs. They are taking care of typically 15 to 30 patients, depending on how many they have on their hall or how many halls they have to have. So they work there. They work in clinics. They work in mental health and mental health institutions. They work in schools. They work, I said clinics already. They work in a lot of places. They really do work in a lot of places. They have the ability to do a lot. In a clinic, they're going to be doing things like triaging and doing vital signs and things, getting everything ready for the doctor to come in or practitioner to come in to see the patient. But outside of that, they're not doing like total patient care like they would be in a hospital setting if that hospital still employs LPNs or LVNs. We talked about their schooling. We talked about their scope of practice and their role. So now we're going to move into the 2-year RN. So the 2-year RN, typically you will find those programs in community colleges and some universities. I work at a university in which we do have a 2-year RN program. And in terms of scope of practice as a registered nurses do it all. We admit patients, discharge patients, we do education. LPNs do education as well. I forgot to mention that. They do a lot of education, a lot of teaching, a lot of interventions they do. But nurses do the exact same thing. So they're, whatever an LPN or LVN is able to do, the RN is able to do those things as well. We just typically delegate to those LPNs or LVNs to do those kinds of tasks. But when it comes to being an RN, we're delegators. So we're the ones who are usually in charge. We're the ones who are taking care of the patients. We do those initial admission assessments. We do the discharge teaching. We do injections. We get our patients up. We do what the CNAs do. We're capable of doing it all. So we do all those things in nursing. The difference between the 2-year and the 4-year in terms of schooling is that obviously the 4-year gets 2 more years of school. And of course the classes are going to be slightly different because you're going to have more classes. We have humanities classes we have to take, psychology classes, statistics classes, your chemistries, your microbiologies, your AMPs, all your science classes like that. I had to take foreign language and PE even with my bachelor's degree in nursing. So all those were required for us. You also have the ability in nursing, we take, I think the last 4 to 5 semesters, depending on your school, of just nursing classes. So that's roughly 2 to 2.5 years that you're spending in that nursing component alone. And so with that being said, you also have leadership classes in your 4-year program that you do not have in your 2-year program. And the idea behind the 4-year program was for that those with bachelor's degrees could move up into upper management or into management to be like your nurse managers and directors and things like that. And so it's not supposed to be where your 2-year RN can move into those positions. However, I have seen a paradigm shift where if you know somebody and you meet the criteria otherwise besides the degree, you can move into upper management with an associate's degree. So I think that just depends on sometimes where you're at and who you know. But typically it's supposed to be where the 4-year can move into upper management. Next, we will go into the master's level. So in order to get your master's, you have to have a degree in nursing first, or not in nursing, but be a RN first. So you can, I forgot to mention, when it comes to being RN, you can have a degree in another area, another 4-year degree in something else. And they have accelerated programs now where you can go to school in an accelerated RN program, and they will take some of your other classes from your other degree and use those as prereqs for you to enter into an accelerated program at those places. Now, those programs typically are accelerated for a reason. So you're going to go be in school from 12 to 15 months, and you will have, in some places, 18 months, and you will have a degree as a registered nurse with your other bachelor's degree being in some other area, altogether different. So they have those kind of programs, and they have bridge programs as well. So that's another way to get into nursing with another degree, but you have to take an accelerated program. So back to the master's. So at the master's level, you have different options as well. So the number one thing people always think of when they get a master's degree in nursing is nurse practitioner. And there's nothing wrong with being a nurse practitioner. I have nothing against it. I never wanted to be one. And that's another story again for that. But to those who want to be a nurse practitioner, you have to be a registered nurse first. But in case of you all who are thinking, like, are there other options besides being a nurse practitioner? I know in my area, being a nurse practitioner, that market is oversaturated. So basically that means that we have more nurse practitioner graduates than we have positions. So we have a lot of nurse practitioners who have degrees as being a nurse practitioner, and they're licensed even, but they can't find a job doing what they want to do as a nurse practitioner. So a lot of them turn to education to find a fill-in until they actually can get a job as an FNP or PNP or NNP or whatever they're trying to do. Just depends on what you're trying to do. FNPs around here are oversaturated. But again, that's not to discourage anybody. You know, you need to find out what's good for you in your area. So besides being an FNP, what else can you do with a master's degree? You can be a nurse educator, such as I am. I'm a nurse educator, so my master's is in nursing education. I'm not a nurse practitioner. My master's is in nursing education, and that's what I wanted to get my master's in. I teach. That's basically what I do. I do the clinicals, I do the didactic, which is the classroom, but that's what I do, I teach. You can also get a master's in informatics. So those are the nurses who actually deal with the charting systems and the computers and making sure that we change our charting systems to stay innovative and to stay up to date to current practices and things like that. So that's the ones who deal with that as informatics. You can have also masters in nursing administration. And administration, those are the ones who do like not your charge nurse, but your director of nursing. Your CNOs could even be sometimes a master of prepared nurse. Your people who are basically in the management side. They're no longer at the bedside, they're doing management at this point. So those are the ones you'll see doing that. I've just recently learned that you could actually have a master's in case management. My friend just told me that she's trying to pursue that as her master's option, is having her master's degree in case management. I never knew that. So that's a great option as well for those who wanting to have a master's degree, but they're not interested in being a practitioner, education, informatics, or administration. There's case management. And I'm sure if there's case management, there are other areas of nursing with a master's degree you can get. I know there's a holistic nursing master's. Some people get that as a postmaster certificate program. They'll go back and get that. So there's so many areas you can go into besides being a nurse practitioner with a master's degree. So you can get into various areas of nursing without just doing a nurse practitioner. And I think that was the kind of point I wanted to make. And you can get into geriatrics and be a geriatric practitioner. But also other areas of being practitioners include FNP, which is a family nurse practitioner. You can be a women's health nurse practitioner. You can be a PNP, a pediatric nurse practitioner, NNP, neonatal nurse practitioner. So you can do so many things even in the practitioner role, and specialize in those areas. And again, that's what I love about nursing. It's just so versatile, and you can do so much. Now let's kind of move into the doctoral level. So when it comes to the doctoral level, people cannot believe or don't even know that you can have a doctoral degree as a nurse. And so a doctoral degree is basically a terminal degree in a field that actually has that as an option. So people get confused and think that, oh, I can only be, or when they think of doctor, they think of a medical doctor. So someone who is again, medical doctor or a surgeon or something like that. Now you can be, if there's a terminal degree in that area, that field area, then you can be a doctor of whatever that happens to be. So psychologists typically have PhDs, Doctor of Philosophy. There's even educators in terms of teachers who have a doctoral degree. They get their EDD typically, or PhD. So you have dentists who are doctors. You have judges who are doctors. So that doesn't mean they're medical doctors. It means they have a terminal degree in their field. And nursing is no exception. So nursing has a terminal degree in nursing, and that's actually what I'm pursuing, is my doctoral degree in nursing practice, which is called a DNP. And there are other ones that you can get. You can get a DNP, which is what I'm getting, a DNS, which is a Doctor of Nursing Science, a PhD, which is a Doctor of Philosophy, a EDD, which is the Doctor of Education. And like I said, you can get any of those that you choose to get in nursing, as long as your program is offering that. So people often ask, well, why do you not just want to become a nurse practitioner? Well, I'm not interested in it. That's the short and sweet. I have no desire to be a nurse practitioner. That's not where it's at for me personally. And then when it comes to being a medical doctor, if I wanted to be a doctor, that's what I went to school to do. I would have did pre-med and all that and went to school to be a doctor. But I have no desire to be a doctor either. And again, there's nothing wrong with wanting to be a doctor, but we need them all. We need doctors, we need nurses, we need doctors and nurses, or nurses that are trained at advanced levels. I am ready to eventually move away from bedside nursing and get into more of a business aspect or deal with policy changes and things like that. And so I still love what I do as a nurse, as an OB/GYN nurse, but it's just really time for me to be, 14 and a half years, be thinking about moving on to something different. I want to save my back, for one. Your back will be killing you if you're doing it for 30 years, working at the bedside. But, that is just me. That's what I want to do. So back to the doctoral degree. People are concerned, like they'll say, well, you should get the PhD instead of getting the DNP. The PhD is a Doctor of Philosophy, and the DNP is a Doctor of Nursing Practice. I'm going to get what I want to get because that's what my money's paying for. So there's no reason to feel like you have to be pigeonholed into one kind of terminal degree. You will have people who will say the PhD is better than the DNP, and that's not necessarily true. We have different roles. So for instance, the PhD, they focus on research. They're the ones who are looking into the research of what is going on and why. The DNP is focused on clinical practice. So really, if you think about it, and we do research as well, but we let the PhDs do more of the research, and we actually implement it and put it into practice. So when it comes to the DNP, which is my role, I want to give you an example of how we could work together with the PhD. So the PhD is someone, again, who does research. So let's talk about I'm going to give you just a crazy example of maybe we want to get a new kind of catheter for pediatric patients for some reason. So maybe the PhD people have researched and found this new kind of catheter that is easier to put in, and it causes no side effects, and it's fine for a pediatric patient population. So they did the research and the clinical trial supposedly been done, but now it's time for us to go as the DNP and say, okay, you know what? Since you did the research, let's go ahead and put this into practice now. So then I would basically say, okay, I'm going to take this hospital unit and we're going to put this new catheter into practice. Well, let's say we put it into practice and we do our research and find out that now, for some reason, we're getting more infections, UTIs, from this new catheter than we did from the old catheter. And maybe it's not due to nurse error. We just finding that there's something, a component in this catheter is causing problems. So then we would then go back to the people who do the research, your PhD people, and say, you know what? We are finding that we have a 50% increase in UTIs in our pediatric population with this new catheter comparatively under the same circumstances as we did with the old catheter. So we're going to have to go back to the old catheter until you kind of fix whatever problems that you have. That's kind of how we can work together. So again, there's nothing wrong with doing either one. If you want to be a PhD doctor versus a DNP, in my case, doctor, do whatever you want to do. But that's kind of where, you know, it all falls with that situation. So I like to basically tell people the truth with these degrees, and that you can get what kind of degree that you want to get and still have a job. I've also heard when it comes to the doctoral level that, oh, well, certain jobs, or that PhDs is where people want for education, or DNPs is for the classroom and PhDs is for, I don't know where the PhD is supposed to be working at, but that's what they're telling me. Like, you can't get a job otherwise unless you want to teach. That's not true either. We have people who, I know professors who have a PhD and they teach, people who have an EDD and they teach, people who have a DNP and they teach, and people who have a DNS and they teach. Faculty shortages are so high at the moment that a lot of schools are not caring unless you have, just as long as you have a doctoral degree, and that's all that really matters, as long as you have that doctoral degree. So again, we've kind of talked about the different levels of nursing in terms of entry level, whether you're going to be a CNA, a MA, a patient care tech, going to LPN school, or being an LVN, again, the same thing, being the 2-year versus the 4-year, the master's level, and again, now the doctoral level of nurses. And people ask me, specifically me, like, what am I going to do with my doctoral degree? Well, my doctoral degree, my specialty, you know, all areas kind of have specialties. So my area is in executive leadership. So with executive leadership, I can actually be a CNO at a facility, at a hospital. So that's the chief nursing officer. I could be, obviously I could teach, which I'm already doing that with my master's degree. I could be, you know, teaching at a, you know, I could be an educator at a hospital even. So there are just so many jobs that you can get out there with doctoral degrees, and of course you can still clinically practice. There's nothing going to take that away from you. But the biggest thing I wanted to point out, to get to any of those advanced degrees, you have to be a registered nurse first. So fundamentally, at the end of everything, the end of your credentials, you will say registered nurse, you're RN. You cannot be beyond that without having the RN degree first. So I wanted to make sure that you all understood that you have to be a registered nurse in order to be anything beyond that. Another question that I typically get from students is, I want to be, you know, they're not thinking about being a doctoral prepared nurse. They want to be, and I get this from pre-nursing students or future nursing students. They want to be a pediatric nurse or a nursery nurse or a NICU nurse. And they want to know, how do I do that? What school do I go to for that? Well, you go to any nursing school for that. You go to nursing school to learn the fundamentals or the foundation of nursing. Once you get out of nursing school is when you go specialize in your area. And so there's not a school specifically to be an OB nurse or a pediatric nurse. The school is to be a registered nurse, period. And you then go into that area of nursing that you choose to go to and learn what you need to learn in that area. So some places are requiring you to do med-surg first for a year and get that kind of fundamental foundation experience in med-surg, and then they want you or may allow you to go into other areas of nursing. For me specifically, I didn't have to do that. Luckily, and I say luckily because I did not like med-surg, I got into OB nursing right out of nursing school. So I was actually excited about that. I have no plans to go to med-surg. I just don't care for it. And there's nothing wrong if you do. That's you. Again, nursing is so diverse. We have so many things that we can do in nursing that's great. You do what's good for you. So hopefully this video has been helpful in kind of letting you know, maybe a good entry point for you. Maybe you want to start and take the scenic route. Again, nothing wrong with that. And become a CNA first until you can figure out if this is what you really want to do. Some other people know, so they go right into nursing school from that route. And then other people typically may just go into the LVN route because they're still trying to figure out what they want to do. Or sometimes they have family issues or children where they need to say, okay, I need to start somewhere where I can get in, get out, and start making money to take care of my family. And then they eventually go back to school while they're working. And that's great for them. That's what you needed to do. Some people come to nursing as a second career. And that basically means you have a whole nother degree or career doing something else. Some people were like military for so many years, and it's like, you know what, I'm going to retire from military and then I'm going to be a nurse. Or I met teachers who they were a teacher, for 10, 15 years, and they decided they want to come into nursing. So second career kind of people, they come in maybe saying, okay, well, I already have a bachelor's degree in this, that, and the other, so I'm going to go ahead and just jump right on into either do an accelerated program that I just talked about earlier, or they're going to do, just the traditional nursing programs. So again, hopefully this has been insightful. You've learned something from this, that you have to be a registered nurse to go into advanced practice of anything nursing related, and that you can start wherever you want to start prior to RN. So you can start with the CNA, work your way up, start with the LPN, work your way up, or start with the 2-year and work your way up to your RN, or go to the 4-year and work your way up if that's what you choose to do. And there's nothing wrong with staying wherever you want to stay in nursing. So if you happen to like being a CNA, and I've met people like that, stay there. Nothing wrong with it. If you happen to love, which I've met a nurse who she's an LPN, she's been an LPN for 40 years. She has no desire to do anything other than being a LPN. So she's not going back to RN school. There's people who they're okay with the 2-year RN, they stay there. And again, this is not to knock anybody. Be where you want to be. But just know you have to start somewhere if you want to start, and you can end wherever you want to end. So again, I hope this has been enlightening for you. Thank you so much for watching. If you are new to my channel, please subscribe. This is primarily a nursing channel. However, I do like beauty and fashion, so you will see things like that. If you happen to enjoy beauty and fashion just as I do, and you are a nurse or a future nurse, definitely subscribe. You'll be very much entertained by this channel, because I do a little bit of everything when it comes to that. If you are a pre-nursing student and you have questions, please comment below or leave your question below, and I'll try my best to answer them. My IG name is the Melanin. No, it's not. It's MelaninRN_MPN at the Nurse Lounge. You'll see the other name is the Nurse Lounge. So that's where I'm at over on Instagram as well. So definitely go follow over there. But again, thank you so much for watching this video. And until the next time, you take care.